ziua, mă numesc Rodica Bălașa, sunt neurolog, specialist în scleroză multiplă. Am făcut această introducere pentru a vă spune că un vis a devenit realitate, și anume acela de a organiza o conferință internațională pe tema sclerozei multiple în Târgu Mureș. De ce am putut avea îndrăzneala să ne dorim acest lucru? Pentru că, după cum unii știu, Centrul de Neurologie din Târgu Mureș a fost primul în a trata scleroza multiplă cu medicamente modificatoare ale evoluției bolii în anul 2000. 100 de bolnavi erau tratați la Târgu Mureș, 100 de bolnavi erau tratați la București. Iată că în peste 20 de ani, de unde se începuse cu 200 de pacienți în toată țara, actualmente România tratează peste 5700 de pacienți cu terapii moderne de ultimă generație. În acest sens, îmi face o deosebită onoare să o am alături de mine pe doamna profesor Melinda Magyari. Doamna profesor este un cercetător cunoscut în toată lumea, extrem de respectat datorită muncii și a publicațiilor extrem de valoroase. Doamna profesor este profesor de neurologie la Universitatea din Copenhagen și este director al Registrului danez de scleroză multiplă, registru cel mai vechi care funcționează din 1956 de la nivel mondial, un registru care cuprinde peste 30.000 de pacienți, dintre care 16.000 trăiesc actualmente pe teritoriul danez, cu toți pacienți cu scleroză multiplă. Deci, doamna profesor, bine ați venit în mijlocul nostru, este o onoare să vă avem alături de noi, mai ales că dumneavoastră sunteți târgu mureșeancă prin naștere și prin primii ani, să spunem, de școală. Vă rog, doamna profesor.
Mulțumesc frumos pentru așa de o frumoasă introducere și îmi face plăcere că vin în orașul meu natiu.
Mulțumim foarte mult. So now we will turn to English. It's an honor for me to present you Professor Melinda Magyari, Professor of Neurology at University of Copenhagen and also Director of the Danish Register in Denmark, one of the most famous registers, and that is sure it's the oldest register that goes on without any stop since 1956. So we will have a very pleasant discussion, and first of all I want to thank you for the generosity that you accepted our invitation to give a very important lecture tomorrow at our conference and also to have this discussion with us. So first question that popped in my mind was to ask you, dear Melinda, how you choose to be a neurologist, and most of that, how you choose to be a specialist in multiple sclerosis.
Yeah, it may be a coincidence, but I was always very interested in the brain and how it works. So when I had the possibility in Denmark to have an introduction in neurology, I did that, and then suddenly I became more interested. Then I applied for a residency, and I became a neurologist.
Well, thank you. I might say that as we are of the same age, so of the same generation, even though I'm not comparing myself to you, but still, when we started neurology for multiple sclerosis, we didn't know much. When we started treating patients with multiple sclerosis with disease-modifying therapies, it was 2 molecules. And then now we have more than 14 molecules, so it's a very interesting field. It's developing every day. The research done in this field is amazing because, as you might know, the multiple sclerosis affects young adults, and 50% of them in 10 years might have a disabling neurological status that might lead to them to stop their working. So there are a huge problem, a huge healthy problem, and an important burden on the economic system of every country.
So actually, just to answer the second part of the question, why was multiple sclerosis? because now I was the only one who was working in lunchtime doing the clinical trials of interferons. Then the professor said, okay, now you work so much, Melinda, I will take you to a conference. Then suddenly I became interested. So,
okay, I see. And I wanted to ask you, because this was a very important thing when I read a little bit about you and your work, your previous work. I saw that you are the director of the Danish MS Register, which is famous, which I saw many of your publications on real-world data, on all the type what anybody could think from different points of view. You analyze the patient. So how this register it was implemented, and how, regarding the structure of this register, how is this organized in Denmark? Because we hope that it will be possible to make such a register in Romania also.
Yes. Thank you for the question. This is also a bit a story of coincidence. I will make it short, but it actually started in 1948. When there was a young doctor in Copenhagen who saw that the professor, whenever he diagnosed a patient with MS, put a pin in a Danish map, and he could see there was an agglomeration around the big cities. And he decided to gather all patients in Denmark with multiple sclerosis. So he asked the banks, the hospitals, the schools, even the Salvation Army. And if you came with a patient with multiple sclerosis, you get, I don't know, a little of coin. So it was before the GDPR. So if your neighbor had multiple sclerosis, you could go to him. So he finished at 1956, of course, with the help of his wife, who made all the administration, and he called it prevalence date. That he realized, it was Kai Hyllested, he realized that 25% of the patients who had a diagnosis of MS had not MS. Then he realized to carry on and collected all the paper records and collected data into the registry. Then he passed it on to my supervisor, who called Niels Koch Hendriksen, who continued that work. So actually, in my early neurology years, I also were collecting data from all hospitals. I think the reason behind the success of the Danish MS registry is that in 1996, when the first disease-modifying drug became available, the health authorities made it mandatory to collect data in order to document the effectiveness of this drug. So, and therefore I would say my colleagues are disciplined. We have only 30 MS clinics in Denmark, and we are used to collect data.
Yeah, the northern populations are more strict, more organized than these Latin Balkanic type of populations than us. So, but let's say if you want to treat, if I understood correctly, if I want to treat a patient with MS, I'm almost obliged to send the data to the center in Copenhagen.
Yes, actually,
so? Yes, by email.
Yeah.
But
no, I made now an online data collection platform. It's very smart now.
Okay.
So the doctor opens the platform, see in one page the whole history of and enters the data. Then we receive the data and of course cleaning it and makes it. But the patient, we have to collect the data without the informed consent. Otherwise, the patients are not able to receive the expensive treatment, because the health authorities would only pay for the disease-modifying drugs if we can prove some effectiveness.
Okay, I see. So it's a balance that needs to be positive at the end of the day regarding the results. But of course, maybe I should stress that now we have disease-modifying therapies that are more aggressive with the disease, that are, of course, more effective, but unfortunately they are more expensive. So this is huge burden for the economic system. For example, in Romania, in the last 5 years, the money spent of disease-modifying therapies grew 5 times. Now we have more than 40 million euros each year involved for treating the patients. I think in Denmark it's much more than that, but I'm just saying that everybody can understand that it's a huge amount of money, and for that amount of money, the economic system of a country needs to see results. So these results are easily shown if we have a register and we have a database. And one other question was, I saw that starting from this register, I understood, you have a lot of publications regarding females with MS.
Yes.
I saw some with Patricia Cole,
yes,
Sandra
yes.
Vukusic, and so forth, so on. So how could you, let's say, which are the main problems in a female that have MS when it's diagnosed? The female is in her active sexual part of the life, meaning wants to procreate, to make children, and so forth, so on. So what is what you observe, because you analyze data with thousands and thousands of women with MS, what would be the main problems regarding female having multiple sclerosis?
Yeah, thank you. So, good gender difference and females, this was one of my main topic at my PhD, and I would like to work further with it, because I think that personalized medicine starts by distinguishing age and the two biological sexes.
Okay.
So, and I think 2/3 of our patients are female in their reproductive age. So we need to advise them on contraception, on family planning, on pregnancy. We have to very carefully plan their disease-modifying therapy. So we have to ask them, they ask us the question, can I be pregnant? Would the pregnancy deteriorate my disease? And actually we analyzed all data from all pregnant women in Denmark compared to controls and all their reproductive history. And luckily we can say today pregnancies do not affect the disease course. So, so the disability milestone will not increase, and we are encouraging women to be pregnant early, plan it together with us to avoid postpartum relapse. We want to demystify these things, because we want to give the women the opportunity to be mothers like everybody else.
Okay, thank you very much. One other question is, if you saw, because I saw also some of your publications regarding the habits of adolescents, and how these habits, I saw the passive smoking, you analyze it from this point of view, from obesity point of view, and so forth, so on. So what did you see, for example, regarding comparing with 20 years before and now? What are the adolescents more exposed to if they have multiple sclerosis? Meaning, what would be your idea about the environmental factors that influence the onset of multiple sclerosis now compared with 20 years before?
Yeah, I think this is an important question, because many patients ask who get multiple sclerosis, what can I do for my child not to get it? Because the genetic cannot be changed. However, genetic plays only a minor role. We are more and more finding out that there are lots of environmental factors, and it's a complex interplay. And the Epstein-Barr virus, we cannot do anything now. We hope in the future would be a vaccine. However, obesity, and we have seen in the Danish MS registry, and because in Scandinavia everything is registered, so you can link all those data together with the other registry. Even your school grades here registers and everything. So we have found some old school records where we saw that obesity in the puberty, pre-puberty, increase the risk of multiple sclerosis. So it's very important to fight obesity. It's very important to fight smoking, because we also find that smoking increases the risk of multiple sclerosis. And we also find that night work. So working in the young years, in the night, maybe at the
or at the computer.
Or at the computer.
That is a habit now.
So being up at the night shift work increase the risk of multiple sclerosis. And another thing which is a bit paradoxal is the alcohol. But in the Danish and the Swedish MS registry, we actually find that alcohol did not influence, or maybe have a bit of protection in moderate dose. However, this is only true for the Danish and the Swedish. They have a different genetics.
So it's an open discussion.
And yes, and it's very interesting because in Denmark and Sweden, they have been drinking small amount of alcohol since the Middle Age because the water was not clean. So they may be adopted to another way than we have been done. So this is not a good advice that...
yes. Okay. So alcohol is still in debate.
Yeah,
Let's leave it like that.
Yeah, so I would not advise anybody. However, we have to identify factors we can prevent, and this, and of course, and not only this. We also find in Norwegian studies that being out in the sun.
It would D vitamin maybe.
Yes, so actually separately from D vitamin.
Separate.
Yes, so outdoor activities
that will help.
That will help a lot, and also physical activity. Physical activity also affects the immune system. So all these things, common sense health.
A healthy way of life,
yes.
that it might help in all diseases,
yes.
preventing most
yes.
of the
yes.
diseases.
Also in Denmark, we saw that children who have been playing more outside have less risk to have multiple sclerosis, and this could be my worries about children today staying at the computer in the night.
And in the night it's worse even
yes.
in the day. Okay, what I want to ask you, because this TV channel is the channel of the university, how is the teaching, not the teaching system, but how do you approach your students for teaching them neurology? Is there a more theoretical, or you are trying towards a more practical approach? Are these your students also having an internship in the hospital and combined with the classes, or how is it done?
As in Denmark, we have a very much practical approach. So we also have a theoretical approach, having the lessons, which is changed a lot during COVID-19, because now the students have the possibility of having online, which is very boring for me, coming in the morning and maybe sitting 20 students and the rest just waving from their computer. So I don't think this is less positive for my enthusiasm. However, we have the internship, when the students are in the same line with the doctors as they meet in the morning. Usually you have one supervisor they are there for 4 weeks. And then in the morning we divide them. So everybody is following a doctor or having records and following doctors at the night shift. And we learn them practical, so how to do a neurological examination, how to do a lumbar puncture, and how to
assess a neurological patient.
Yes, and we give them the possibility to work. So in Denmark, we always had the possibility to work in a doctor's job as a student. I did it in 1999 when I started there. So because we have lack of doctors in Denmark, then a student can come and have a job and maybe just write the records, not taking any decision, but doing.
Already important.
And students are very happy for that, especially those who want to be neurologists. And also, if they ask me, I have some students now say, "I'm interested in the research you do. Can I come?" So we integrate them a lot.
Okay, that is a very important lesson for us. And I wanted to ask you, how is the research fixed in your program? Let's say, because you have your day is 24 hours, obviously. So from this period of time, maybe 10, 12 hours you need to be at home.
Yes.
And what are you doing with the other hours? Because as I saw, your work is the research work is huge. It means a lot of publishing. It means not only writing the paper, but also staying in the lab, reading other people's research. So how do you do that? Because I see you relaxed. I don't see you stressed at all.
Maybe I can say.
Maybe you give us a recipe.
I have a very good husband who helps a lot.
Okay, that is important.
So, and supports a lot. Have yes, and our children are not young anymore, so that helps also. But I have 50% clinic and 50% research. So 50% of my time is paid by the MS Society, from the Patient Society, where I do research.
Oh, I see.
So. And I really try to organize it, but it's not. This is not a 50 hours work or job. Sometimes I do it in the evening. I write articles, and when I'm traveling, or I am very, very good to multitask. But I also try in my research group to give the responsibility more and more, and see, oh, you can do it alone. And just supervise them. So I'm getting better to let them.
Other people do, but still you need to check everything.
Yes.
And to see once again.
But I have learned to be very structured from the Nordic people. So I have.
Yes, I think that is an important lesson to learn.
But it's also important to be like more Central European in order to communicate and things. I think that the combination of my personality and the Nordic structure, somehow it's a win-win.
Well together.
Yes.
Yes, because I just wanted to ask you, how come you chose Denmark? Because they say that the Danish people are the most happiest people in the world, even though they don't live the longest lives. They live happy life. So how come you choose the Denmark for your country, and it's clear that it helped you a lot. You fulfilled all your career in this in Copenhagen. So it's clear that for you going there, it was a very good decision. But how did you take that decision?
I find a boyfriend who was Danish.
Oh, okay, perfect, the classic way.
And then I was still a student, so I went there as an exchange student. Then they advised me, they advised me to stay there because Denmark in the beginning of the 90s said that they have so many doctors, they would never need other doctors. Oh. So if I really want to make plans, so I may finish there. So I finished the last 2 years of my university in Danish in Denmark.
I see.
So, and whether they are really happy or they are just very content, I think they are very content. Now I've been living there, they are happy for what they have.
Yes, and they appreciate
what they have, and they don't do unrealistic. Sometimes I thought if we will put a Central European person there, it may complain a bit more.
I see. So I think maybe we should send some students there to understand that to have a realistic expectations in life is the key to happiness, because you need to understand what your skills are, and you understand what you can give to the society, and then to think what you can ask from the society. And then if you find the balance and the right proportions, let's say, you might be happy and feel fulfilled in your life. So at the end, Melinda, I want to thank you once again, but I don't want to end this discussion. I want to ask you to tell us, because I made all the questions, and please tell us what you feel to tell us, and if you want to ask me something, go ahead.
I would also very much like to know how is the student education in neurology is here.
Well, the students in neurology stay in the department for 3 weeks, So we are having a modular teaching system for 14 classes, each class for 2 hours. It's not mandatory to come to all classes. While the classes, we are trying to take patients with us and show them to the students, even though we are showing them registration on the screen. Maybe I think to see it there and to watch me or my colleagues how we examine that, maybe that bring a little more knowledge for them. And also they are doing internship. These internships are for 15 hours a week for 3 weeks. So they have also a person, each group of 7, 8 students have a person, an assistant professor, for example, that takes them to the different types of cases and discuss with them and teach them how to examine from the neurological point of view, because it's totally different from other things that they have learned so far. And at the end, I'm doing a little old-time thing. I'm giving them a paper because I want to be sure that they remember how to hold a pen in their hand. And we are giving them 7 questions, very simple, from semiology. So, and then the exam, that is something like 15% of the note, that paper. But otherwise, we are evaluating them a practical exam, and also we are evaluating them in a written exam that is a multiple choice questionnaire. But a part of that, for example, there is a student association regarding to neurosciences that just was implemented, and we are trying to have other activities with our students, so to bring them near us, and so they can be assured that we don't bite. And the fact that we are strict, exactly what you said, neurology is rather precise science. So if you have a stomach ache, and might be from the head to the amygdala or appendicitis, for neurology, I always tell them that is a very strict cause action relationship, and to know semiology is the basis of neurology. So I just tell them that semiology is like playing tennis with a wall. If you put the ball in a correct manner, you receive it correctly. If not, it's no use. And we try to teach them, because they forgot to have patience and to wait for the conclusions to arrive after they analyze the facts. Normally they draw first the conclusions, they are analyzing the fact, which is not the way to do in neurology.
Totally agree. I always tell them it's like being a detective.
Exactly.
Neurologist, it's really interesting. You have to just have subtle science and then go after it.
Exactly. And also I am telling them, because they want everything very quickly. And without learning, it's impossible to know things. So learning, it's a process that it takes time, obviously. And you need to give that time to your brain to examine and to analyze the knowledge, and then you can use it.
Absolutely, because neurology is about pattern recognition. You have to, so you cannot do it quick. You have to see that. You have to. There is another kind of learning, and
exactly. And I tell them, if you have a good observation and you have a little bit of knowledge, when the patient comes to you and you recognize a certain type of gait, you already know what structure in the brain might be affected. So, but you need to have that knowledge. So without learning a little bit, impossible.
Yes.
Unfortunately, our students are less used to work during their years as a student. So maybe we need to involve them more in a working process, and during also our night shifts and things like that, because then they will understand and will avoid the fact that after they finish the university, they take the residency exam, they choose neurology, and then they realize that this is not for me. So maybe you should know in advance what it suits you or not.
And this is the biggest difference in Denmark. I experienced this from the first year. They have like an association, they can help in the hospitals as nurses, and then like it's called a substitute for a doctor, and I also employ them to complete data. For example, when I do a study, then I said, okay, I want to be really good data, and then I employ them, they go in the records and complete data, then we can talk about it, and then I can select those who are interested and want to do this kind of research. So I always have a team of young students working there for.
That is a very good idea.
So
we should apply it also.
They can earn a bit of pocket money, and then
Well,
they learn a lot.
The payment, I don't know, but at least they have a little bit of experience and something to put in the CV, because that is also important.
Absolutely, and all of them were very happy. They come back and see that was really good for.
Okay. So I want to thank you once again. We appreciated a lot your generosity, your kindness. You're such an open person to share your knowledge with us. And I hope that this is only the beginning, and we are waiting for you in our university and also in the Department of Neurology and also in our research center. Maybe we can work together out to have some activities, because not only research is a part of the activity of a person, of course there are a lot of others. So Melinda, thank you very much and hope to see you soon in Târgu Mureș.
Thank you, and thank you a lot, and I also hope this is only the beginning of the collaboration as clinician and researcher, and we will contribute with some.
Thank you very much. Mulțumim foarte mult.
Mulțumim.